What are some cellular immunotherapies being used in myeloma, and when should they be used?
So there's the role of cellular immunotherapy for myeloma is still under development, but there have been some very exciting advances in that field. At the University of Maryland, we pioneered a type of gene-modified T-cell therapy for myeloma using T cells that were engineered to express a high-affinity T-cell receptor for a surface protein called NY-ESO1, which is a cancer testis antigen that is expressed frequently in patients with advanced and refractory forms of myeloma. And these redirected T cells were able to engraft into patients, proliferate, traffic to the bone marrow, and in some cases help to attack and kill their myeloma cells. And these gene-modified T cells were also quite safe and did not seem to have any significant off-tumor effects. There is also several CAR T products that are under development for myeloma. These are genetically modified T cells that, instead of expressing a T cell receptor on the surface, express a CAR, which stands for chimeric antigen receptor, which is sort of a freak of nature where there's an antibody on the outside and T cell signaling domains on the inside. But once these CARs engage with myeloma cells, they become activated, they induce proliferation and expansion of the T cells, which then can go about killing the myeloma cells. And these therapies also look very promising, inducing a high proportion of responses, some of which appear to be durable, long-lasting. The best place or best opportunity to give these cells is still being worked out. It does seem that CAR T cells and TCR T cells, T cell receptor T cells, work better when they're given after strong preparative chemotherapy, or called conditioning therapy. And it may even be that the best preparative therapy to use is actually transplant, to give patients high-dose chemotherapy, get the myeloma down to a low level, and also create a milieu or an environment in the patient that is most conducive for engraftment, expansion, and activation of these genetically engineered T cells, whether it be TCR T cells or CAR T cells. So it may be that the best time to give them may be actually very soon after high-dose chemotherapy and autologous stem cell transplantation.